This is the middle ear cavity, empty. It's missing 3 ossicles, a set of ligaments fixing the ossicles in place, a pair of tendons, and a nerve. We still need to add 2 important elements that are so often overlooked: the lining mucosa and the air. If we ignore everything from the full image except for the mucosa and the air, what remains is a network of bubbles budding from a single point, the Eustachian tube orifice. This budding process takes about 10 years to be completed, from the fetus to the late childhood. On this video, we'll take a closer look at the developmental stages of the middle ear by seeing each air sac expanding through time in 3-dimensional space. From this process, you will get a thorough understanding of how the mucosal folds take their shape, what the Kerner septum is and how it is formed, but most importantly, how the adult's middle ear spaces correspond to the compartments already existing in the fetal life. So, let's start. By the 20th gestational week, the middle ear ossicles have already reached their adult size. Their ossification process has just started, but they are still surrounded by mesenchyme of the first and second branchial arch. At this stage, the fundus of the first pharyngeal pouch has reached the level of the protympanum. It will then proceed posteriorly and be divided in 4 separate sacs. Each of these sacs takes its name after its location, but terminology can be misleading. For instance, this one might be called the saccus superioris, but it's not the superiormost among the other sacs, as you can see here. The remaining 3 sacs are the saccus anticus, the saccus medius, and the saccus posticus. The cavitation process starts on the 20th gestational week. By the time of delivery, the air sacs have completed the formation of the antrum. The mucosal folds are present too, resulting from the fusion of neighboring sacs. During the first year of life, the mastoid air cell system makes its appearance and it will keep growing at a steady rate till the 6th year. Then, the growth will decelerate and will eventually stop in puberty, until the mastoid and the petrous apex air cells have reached their adult size. After this introduction, let's focus on each air sac separately. This relatively shallow air sac is the saccus anticus. You can see that it's the anteriormost air sac. It mainly contributes to the mucosal lining of the protympanum, but it also covers the inferior surface of the tensor fold and the anterior pouch of von Dressel. The largest and probably most complex middle ear air sac is the saccus medius. This is the origin of the epitympanum and the mastoid air cell system. It passes between the long process of incus and the tendon of the tensor tympani muscle expanding upwards. This narrow passage between these 2 structures forms the anterior tympanic isthmus. The fully developed saccus medius is divided in 3 subcompartments called saccules. The anterior saccule forms the anterior epitympanum. The middle one forms the posterior epitympanum, and the posterior forms the antrum and the mastoid air cells. We can now watch the creation of a composite mucosal fold. The meeting of the anterior part of saccus medius with saccus anticus around the tensor tympani tendon forms the tensor fold. Let's now move on to the Sacco superior. Have a look at its expansion. This is the main air sac of the inferior attic and the upper mesotympanum. It is responsible for the development of the inferior inguinal space, the posterior pouch of von Dressel, and in the majority of cases of the prostac space. Now, try to recall the posterior expansion of Saccus medius from the previous chapter. Directly lateral to that, a small appendage of the Saccus superior creates at the same time part of the lateral antrum and some of the mastoid and zygomatic root air cells. The partition formed by the meeting of these two air sacs is a flat surface with surgical importance. During a mastoidectomy, before entering the antrum, we may come across a flat bony structure devoid of air cells. This has to be drilled before entering the main antrum. It is the famous Kerner septum, formed by the meeting of the Saccus medius with the Saccus superior. The Saccus posticus is the last air sac that we will discuss. Two areas of the temporal bone are formed by the expansion of this air sac: the retrotympanum and the petrous apex air cell system. The anatomy of the retrotympanum needs a separate video in order to be described in depth. But as a general principle, the bigger the Saccus posticus grows, the deeper the crevices of the retrotympanum become, impairing the access to the area during an ear surgery. A medial outgrowth of the Saccus posticus passes below the niche of the round window, creating a path towards the petrous apex. This is the subcochlear canaliculus. Through this path, the air cells of the petrous pyramid are formed. This process takes about 10 years to be completed. After that, the temporal bone has finally taken its adult form. This is everything you need to know about the development of the ventilation pathways of the middle ear. It's difficult to memorize every detail of this process, so I will give you an easy mnemonic at the end of the video in order to remember which area of the middle ear is the result of which air sac. Now, let's remember the key points of what we've discussed so far. Every air-filled cavity of the middle ear, the mastoid and the petrous pyramid result from the first pharyngeal pouch. At birth, the cavitation process has evolved till the middle ear cleft. The mastoid and petrous apex air cells need about 10 more years to fully develop. 3 out of 4 air sacs contribute to the formation of air cell systems outside the middle ear. The Saccus medius creates the major part of the mastoid, the Saccus superior forms the lateral part of the mastoid and the zygomatic root air cells, and the Saccus posticus the petrous apex. The Saccus anticus is the smallest one and doesn't create any air cell system on its way. As a recap, regarding only the middle ear cleft, the Saccus anticus creates the protympanum, the Saccus medius the superior epitympanum, the Saccus superior forms the prostac space and the inferior epitympanum, and finally, the Saccus posticus the retrotympanum. The acronym PEPPER can help us memorize which area of the middle ear derives from which air sac. Now, take some time and try to digest those complicated notions. When you manage to build that 3D image in your mind, everything will look much simpler. Bye, See you in the next video.